Hello everyone, welcome to Confident Dental's podcast. Today's episode is going to be a little bit different because we are going to talk on general population's perspective. Today we have with us Dr. Kishore to give us more information about this topic. Welcome Dr. Kishore for today's episode.
Thank you, Dr. Vinisha. It's my pleasure.
Dr. Kishore, like the proverb, an apple a day keeps a doctor away. Same way, does brushing twice a day keeps a dentist away?
Well, very interesting thought. Brushing twice is mandatory. There are no excuses for that. As long as you have your teeth, you have to brush twice. And that greatly prevents your dental decay as well as your periodontal diseases. Of course, periodontal diseases are multifactorial, but still controlling your biofilm with twice brushing, that is at every 12th hourly interval, is mandatory, no excuse. But that's not about it all. Your oral hygiene, your cleaning of your tongue, your nutrition, your food habits, and also never forget to clean your interdental spaces by flosses, interdental brushes. A combination of all this can by and large keep your dentist away, but don't forget your biannual examination by your dentist. That should not be skipped.
Okay, Dr. Kishore, should all the patients undergo cleaning of the teeth? If so, how often should they undergo cleaning?
Well, every patient mandatorily requests to undergo professional dental cleaning because whatever your oral care regime is, it can reduce your number of visits to the dentist, but it cannot totally take away all the deposits, all the calculus, tartar that forms on your teeth, which requires professional cleaning. And also, don't forget that your dentist, while doing the cleaning, will examine your mouth incompletely and will also come out with any solutions either for your abrasions, erosions, abfractions, or many such dental conditions. So, in short, yes, you need to undergo cleaning professionally. The interval might slightly change depending upon your condition, although it is warranted that you visit your dentist every 6 months for cleaning. Depending upon your oral hygiene condition, your dentist might slightly alter that. But yes, you do require professional cleaning for everyone.
Okay, Dr. Kishore. Now, many people have an understanding that cleaning often will cause damage to the teeth. Is it so?
Very interesting question. I would tell it rarely yes, mostly no. Rarely yes, because if the scalar tips are worn out or an excessive amount of pressure or the power is being used on the cleaning, or already the patient is having non-cervical carious lesions like abrasion, abfraction and attrition, then it might lead to a minimal amount of damage. However, we have to always consider the benefits and the risks, and we have to weigh them together and see which is more beneficial. The benefits of having a regular professional cleaning far outweighs your risk of not having the cleaning done. So that is on one part. In the second part, the scalers that currently the products being manufactured, they are incredibly gentle, and some of the scalers are using a titanium tips whose hardness or HRC hardness number is less than that of enamel. And also there is a new thing on the block called air polishing. Not exactly new, but it's in a newfound avatar, I would like. So this air polishing is precise, professional, painless, and it does the same job as that of your scaling without having any of the side effects of sensitivity. In short, I would assure the general public, by and large, your teeth cleaning is harmless, will not cause any sensitivity or pain. However, you can even ask your dentist whether they are exploring the possibility of doing an air polishing for you. That would be wonderful.
Okay, doctor. You mentioned about air polishing. What is air polishing?
Well, air polishing is a revolutionary new system where you have specialized powders like erythritol, glycine, calcium carbonate, sodium carbonate. So these powders are delivered along with captive water in a precise and painless manner at high pressure, forming a slurry, which when it hits your teeth, removes most of your biofilm. And The best part of this air polishing is this is extremely painless, hardly any sensitivity, and it does a great job in removing your biofilm.
Okay, Dr. Kishore. Now, can this air polishing be also used in children?
Very much so. See, children are more afraid of the sound of the eroters, the scalers, the vibrations, and even great amount of vibrations is not recommended in children who are in mixed dentition phases, because ultrasonic scalers might harm the underlying permanent tooth buds. So, in all such cases, air polishing is a blessing which does the job of removing the biofilm, thereby greatly reducing the chances of caries in children. At the same time, it is mildly sweet tasting, so the patient cooperation is very much there, and the kids would love it because there is no sensitivity, no vibrations, and it's doing the job. So it's a win-win situation both for the dentist as well as the child, I would say.
Okay, doctor. Now you told about all the advantages of air polishing. Now, what are the contraindications of air polishing?
Very good question, Dr. Vinisha. See, as in any treatment, there will be one or two contraindications. The dentist needs to be aware of those. The first contraindication I would tell, since we are using powders here, each person might be allergic to one or the other ingredient of the powder. So, a detailed medical history should be obtained for any allergens that the patient might be experiencing. However, it is very rare and few and far in between. So, that is one thing about the allergy. The second is respiratory problems. If the patient is prone for asthma or is having respiratory conditions which get triggered by aerosols, then we would like to advise the dentist not to undertake this air polishing in such patients. The third thing I would tell is, please don't use air polishing in periodontal pockets which reach far beyond the mucogingival junction, because then if you use air polishing there is a very remote chance of having a surgical emphysema, and the same applies to fractured tooths or open root canals. Please don't use in those areas. As long as you are following these very few contraindications, I think it should be safe for most of the patients.
Okay, doctor. And you also know that our population has a habit of chewing tobacco and also using a lot of betel nut and quid things. So, can the stains also caused by those be removed with air polishing?
I would tell yes, because there are multiple powder options available here. The smaller the particle, more refined the powder is. The bigger the particle, the more stronger it is. So, especially in the stains that you talked about, like the pan stains, gutka stains, coffee stains, we recommend you to use 54 microns calcium carbonate or sodium bicarbonate. This, along with the control of power in the scaler unit or the air polishing unit, can by and large remove most of the stains. But one thing the dentists need to remember, there are two kinds of stains, intrinsic and extrinsic. Air polishing will not work on intrinsic stains such as fluorosis, and also in certain conditions your tea stains or coffee stains would have percolated within your enamel because of the porous nature of the enamel. Air polishing might not work on those stains, but the coffee stains, the tea stains, the green tea stains and the pan stains, what you told, and even the tobacco stains for that matter, air polishing does a wonderful job of removing those stains.
Okay, doctor. Air polishing removes biofilm, air polishing removes stains. Does it also cause any sensitivity or pain for the patient?
The use of air polishing itself is to prevent the sensitivity that was associated with your regular ultrasonic scaling. So let the patients be very confident. With air polishing, they will experience no sensitivity. And since majority of the biofilm is cleared with your air polishing, there will be hardly any requirement to use the scalers on their teeth. And even if they have bulky calculus and it requires the use of scalers, air polishing with PTB comes with titanium scalers which can in a very gentle manner remove your stains and your calculus on your enamel. Since titanium is softer than enamel, the sensitivity experienced by the patient even during scaling is far less than your conventional scaling. So let them drop their fears and freely undergo the air polishing.
Okay, doctor. Our audience would also like to know, is there any difference between teeth whitening and air polishing, or is it the same, or how different it is?
Okay, very good question. Air polishing and teeth whitening are totally two different procedures. Okay, teeth whitening is a elective or a selective procedure that is done to whiten your teeth, and they use peroxides. It might be hydrogen peroxide or carbamide peroxide that percolates inside your enamel and oxidizes your teeth and removes the stains. So that is more of a cosmetic procedure. Whereas in air polishing, it is not a cosmetic procedure but more of a functional procedure. In the sense, air polishing is used to remove the stains, the biofilm, and to make your teeth healthy. Of course, people having extrinsic stains like punch stains, tobacco stains will get their teeth whitened to certain extent because the removal of the stains, but inherently air polishing is not devised to whiten your teeth. The two procedures are totally different, so let them not have any confusion on that.
Okay, doctor. Recently, we celebrated the World Oral Health Day on March 20th. What is the theme of this year?
Every year, World Oral Health Day is celebrated on March 20th, and they come out with a theme. And this theme is valid for the next 1 year. This is basically done to raise the awareness about the link between the oral health and systemic health in the patients. The theme for this year's World Oral Health Day is a healthy mind in a healthy oral cavity. So how does mind get linked to oral cavity? There are two things here what we should know. One is, once the patient have a healthy set of teeth, they will have a confidence to smile, to speak. They will have less of social stigma. They will be more open to meet general public, and they'll be more confident in meeting them. So it plays a major role even in their boosting their confidence. So that is one thing. On the other hand, the periodontal infections in your mouth can even affect your central nervous system, leading to Alzheimer's disease, what we call the periosystemic interrelationship. Even in that manner, your oral health is directly influencing your mental health. So that is the theme for it. So undergo your scaling, undergo your air polishing, keep your dentition healthy, and have a good oral health, general health, as well as your mental health.
Thank you so much, Dr. Kishore, for giving us great information about the air polishing unit and also how to maintain our oral health and how it's linked to our systemic health. Thank you so much.
Thank you very much, Dr. Vinisha.
Thank you everyone for your patient listening. Follow us for more such content and don't forget to subscribe our channel.